romantic relationships, if we really want to talk about romantic relationships, require what state first? A state of safety. So unlike what a lot of people think about romantic relationships as fantasy relationships of seeing someone across the room and falling in love, true, strong relationships require liking the person and feeling safe with them. So in clinical settings, what you often find out is that people who are passionately bonded to each other, but who don't like each other, create the worst relationships. Since there's a degree of violence, aggressiveness, misunderstanding of communication, yet they can't live without each other because they have a visceral bonding that's occurred. So what I like to talk about, and this is actually in conjunction with my wife, Sue Carter, who studies oxytocin and social bonding, is that there is a love code. So it's a code, just like a combination on a combination lock. And the sequence is critical. You first have to have a social engagement system that enables you to feel safe with the other person. Once you feel safe, then proximity can occur, physical contact can occur, and then you can get the oxytocin and the other neuropeptides that are involved in strong social bonds. But if you flip the order, you're in trouble. So you can get bonded, but you might not like the person. So the social engagement system is functionally a set of exercises to evaluate the danger first in psychological distance and then in physical distance. The real issue is, do you feel safe with the person? So the comments that I used to tell my children before I actually developed the refined model was, does she treat you well? But the real point, what we're really asking is, do you feel comfortable with that person? And this leads to the next issue, because we've talked about immobilization as a defensive system, and what we really want to talk about is immobilization without fear as an intimate situation. And that requires that social engagement system to downregulate immobilization defense, just like I talked about play versus fight-flight. And so you watch what, in a sense, we call it foreplay, or when people meet each other, it's a lot of face-to-face. And then when safety occurs, there's no need to do face-to-face. And then reproductive behaviors occur, or nursing behaviors occur with the baby. So if we really were to build a model or a manual of how you would develop good relationships, you would first find yourself safe and comfortable with another person, and then you would, in a sense, really start becoming bonded. So there'd be steps along the way. And our nervous system does very well with that. So we deal with familiarity, and then we are comfortable, and then we become a couple.